Isn't randomly. Okay.
Okay.
Like we are.
Excellent. Well, I've got a live counter here, so I think that means it's working. All right. Thank you for your patience. All right. Hi, folks. This is Dr. Sarah Merritt and Dr. Malini Khanna here on Lifestream Health Center's Facebook broadcast, wanting to talk to you about pain and educate on how we can help patients live life better, how we can help patients get relief with injections, medications. And Dr. Khan and I both work in this space as interventional pain doctors. And so I think we can hopefully offer some insights today for those of you who have struggled with pain. Don't be shy to put a question in the comments. If you have a question, something you want to ask either of us, please jump on in. So my guest is Dr. Malini Khanna. She is a practicing physician in the Philadelphia area and a physiatrist. And I would love for her to share with us a little about what that is and what her practice is like.
Sure. So I'm a physical medicine and rehab specialist. I just started my own practice in Philadelphia. It's called Concierge Spine and Sports Medicine. And I do a lot of lower back pain. And then because of my PM&R training, I do a lot of sports medicine as well. So I treat shoulders, hips, knees, everything besides the feet mainly, because I leave that up to the podiatrist.
Right.
So
yeah. So really most painful conditions, patients can see a fellowship trained pain doctor like yourself or like me, where we treat, pain from most any part of the body.
Correct.
Absolutely. Very good. Well, so I think what's interesting about Dr. Khanna's practice is that she's got a hybrid model where she's helping patients who have really any type of insurance as an in-network provider, but then also has some special out-of-network services, trying to offer more and to be able to be, I think, a excellent resource, particularly for patients who have maybe something like a high deductible health plan. And maybe we can talk a little about what that is, or why it would make sense to see a doctor like you in that situation.
Yeah, absolutely. So nowadays, insurances are dictating how we practice medicine, and they're also on the other end of the patient end, they're also increasing their deductibles, their copays. And sometimes patients don't realize that they have really high deductibles, or they choose a high deductible plan so they have a less monthly payment because they think they're young or healthy, or they just maybe can't afford to pay the monthly payments because insurance is just so expensive these days.
Right.
So what I try to do is try to be very transparent about my prices, and I offer these out of network services for people that have these high deductible plans so that you can get in to see a doctor right away. You don't have to wait 4 to 6 weeks to be seen. I try to get people in between 24 to 48 hours. If you do have out of network plans, we do still submit it to your insurance and see if we can get any money reimbursed. But unfortunately, with high deductible plans, you got to reach $10,000 sometimes before you see a penny back. So, the benefit of having someone like myself in these services is that I can, like I said, I can get you in right away and I can start your treatment right away, and I don't have to follow the insurance rules. So if someone comes to me with acute lower back pain, shooting down their leg, and maybe they haven't tried physical therapy yet, I'll just go ahead and offer them an injection to kind of jumpstart their pain relief. A lot of insurance will say you can't do that. You got to wait till they do 6 weeks of physical therapy, or they got to try NSAIDs, which are non-steroidal anti-inflammatories like your Leaves and Advils, or they'll say you got to try a chiropractor. My goal is to not have people on medications, to not have people depending on narcotics. So my goal is that if I can get you in, you have screaming leg pain, put the medication right where it needs it, and then give it a chance to work. And then you go to all these other services. So that's kind of my goal with doing a concierge practice, is that I'll practice medicine how I would like to practice it, and how I think it's fair to the patient. How,
Right.
if I were in, screaming pain, I want to be treated right away of what the doctor thinks is the best course.
Absolutely. Yeah, I think that's really important, because I do think, sometimes patients get in a situation where if a practice is strictly on a in-network basis and really just used to operating in one way, they may not have the flexibility to adjust for situations like that. With the patient, well, I haven't been able to go to physical therapy, but I'm so disabled by this. I want to get a second injection, or I want to get an injection or a second injection before I get to any therapy. And so those are situations, it sounds like, that you would deal with in your practice.
Absolutely. And there's another thing, that we can discuss is how in the last year or two, how the insurances have now said that you can't do a series of epidurals. And if you do, you have to change the levels.
Yeah.
It's been kind of frustrating to kind of practice that way. Have you found that to be a little bit of an annoyance? Has it affected you at all?
Yes, not every insurer has that type of specificity in their coverage rules, but for the ones that do, yeah, you really need to, as the provider, right, we really need to be attuned to that and trying to make sure that we're aware of, like, what's your plan for a patient who's getting injection or a series of injections, so that we know, hey, what is your insurance plan? What do they cover? And make sure that we're aware. In my practice, I would say we kind of do both. There would be times that we might adjust the plan or try to understand what the plan's requirements are. But I can also say that we've had times when we've, if a patient and I have discussed a certain plan of care, hey, here's what I think is right for you. We can try to authorize it after the fact, but letting the patient know it may not be authorized. There have been times where we've provided an out-of-network service that they might come back and seek reimbursement for later, if possible. Yeah, I think that the problems with the series is definitely one of the challenges that we've seen. So in your area, you see patients with back pain. You treat neck pain, neck injections, as well.
I do send out my cervical epidurals and RFAs. Okay. I just got to kind of more on the sports side of things. So I do mainly lower back. I do all the lower back spinal injections. And then I also offer something called percutaneous tenotomy. I don't know if you're familiar with that. Yeah.
So a little bit. Yeah. I want to know more, though.
Yeah. So that's for chronic tendon issues. Mm-hmm. So I do it a lot for tennis elbow, a lot for rotator cuff issues. So I will also do it for your Achilles, your knee, but mainly it's like elbow and shoulders that I see a lot of. So tennis elbow, and I don't want to leave out golfer's elbow. So both sides of the elbow.
Right.
So any chronic tendon issues, so it's a scarred tendon or it's an overused tendon, we use this specialized needle that goes in and it breaks up all the scar, and it breaks up any calcification, and it pulls it out.
And this is something that's done under an ultrasound, so a live ultrasound, right? So you can kind of watch it happen, and you make sure that you're targeting the right area.
Yep, exactly. So it's all ultrasound guided, and you can actually see the calcifications break up, and then it pulls it out, and it's just a needle doing it. So there's no sutures afterwards. There's no scar afterwards, and patients do really well with this procedure. Mm-hmm. So
how long does it take?
To do the actual procedure it can be anywhere from 15 minutes to 30 minutes.
Okay.
Like a really, really bad shoulder that's got a lot of calcifications, you're kind of in there really breaking up those calcifications for quite a while. Mm-hmm. Versus an elbow, which you just go in, clean it out, and then you're done. But all these cases do have to go to a surgery center. So that's the only way the insurance will cover it, is through a surgery center, because they consider it a surgery, even though it could be done under local in the office. But
got it.
But the shoulders usually are painful, so I do offer them sedation if they want it, and almost every patient takes that. And same with the Achilles; they're pretty
no doubt. And what kind of results do your patients see? I mean, is this something that helps them avoid other surgeries, or what would a patient expect after this type of procedure?
Yeah, for tennis elbow, it's amazing. I've probably get like 90% of the people get better. Again, you can't help everyone in medicine, but about 90% get better. So these are people that have tried a steroid injection, they've tried physical therapy, some have even tried PRP, which is platelet-rich plasma. And then I go in and I remove what the diseased tissue that's causing their pain, and they get amazing results. It's not instant. It's like 6 to 12 weeks that you see the results. And then it kind of prevents them from having to go to an open surgery that could take 6 to 12 months to heal.
Right.
And then
the patients that are a good candidate for this, is this like, do they need the surgeon to say no surgery? Or is it more like it could be their choice of like, well, the surgeon said I could get surgery, but I'd rather try this first?
Usually I work together with the surgeon. A lot of times the surgeons, like for tennis elbow, don't want to do the surgery for whatever reason. So a lot of times they want them to have this first. Same with the shoulders. It's kind of, that's a little different. That's like if we see the calcifications, I get referrals from surgeons saying, can you try this first? Because they don't want to go in and have to put the patient through like a year-long recovery if I can get it done and give them only a 3-month recovery. So it's kind of like we'll work together about, like what's best for the patient. But this is usually the more conservative approach. So you try this first. If I can't help you, then we move on to the surgeon.
Got it. And then when you do one of these procedures, is there anything injected at the end? Like, is there a nerve block aspect, or probably not a steroid aspect, but I don't want to make an assumption. You tell me.
No, I don't do steroids. So I take them off all anti-inflammatories. I treat it almost like a PRP. So you take them off all the anti-inflammatories, and then you keep them off of it for 6 weeks afterwards. No steroid injection after the procedure. I do add Marcaine just for the day of, which is a long-acting numbing agent. So they walk out of the surgery center feeling really good, and then it wears off about 6 to 8 hours later. But I don't do a nerve block. I sometimes will offer the platelet-rich plasma, the PRP, at like 6 weeks if they're kind of hitting a plateau in their recovery. Then when we take out the scarred diseased tissue, sometimes it needs more time to fill in. So either we'll say, okay, give it 6 more weeks, or it just needs something to fill in, like it needs like a boost. So then we poke it and fill it in with PRP, and then those patients do amazing, and it really resolves their issue. So they don't have to come back for more treatments. But they, of course, have to still go to physical therapy and still do their exercises. And
yeah, I mean, this is very, very cutting edge stuff to have people, getting regenerative treatments in your practice. That's fantastic.
Yeah.
I think in terms of the potential for PRP, so that's not necessarily for every patient, just depending on their recovery after a percutaneous tenotomy. Interesting. Yeah, that's very cool. Well, I think that's super interesting. And during their recovery, they will all do physical therapy, or some of them, or at a certain point? Tell me about that.
Yeah, I send everyone to therapy after 2 weeks.
Okay.
So we let it rest, no repetitive exercises for the first 2 weeks. And then we slowly reintroduce the exercises, because they do get a little weak because we're pulling out tissue. So they do get weak, and then we got to kind of build back up the muscle.
Yes.
And then like I said, by about 3 months, it's at the kind of at the peak of their recovery. And if they're doing great, we let them kind of go back to their sport specific activities. If they're not doing great, then we send them to the surgeons. And
do we think the body will lay down some new tissue in that area where the tenotomy's been?
Yeah, you actually see it on ultrasound. It's actually pretty cool. I've been doing it for 10 years, and you can kind of start just start seeing like these little streaks coming in, and I'm like, oh, this is cool. This is like
new. Yeah.
this is the new tissue being laid down. So just from doing it for so long, I've kind of picked up on these like new streaks coming in on the ultrasound, because I do the ultrasound at 2 weeks post-op, 4 weeks post-op, 8 weeks post-op, 12 weeks post-op. So then I can see the progression of that like blackened area filling in.
Yes.
So it's a great procedure. It's a great tool to add.
Yeah, that's awesome. That's awesome.
Yeah.
Yeah, I think that there's such a need for sure, because I would just share that in my practice, I see all types of patients with acute and chronic pain, and very often folks do want to how can I minimize medication? How can I avoid surgery and all those things? And while medications and surgery may be appropriate at times, a lot of folks, if it's possible, want to do more with less.
Of course. Yeah. I mean, that's, like I said, always conservative care first.
Mm-hmm. Very good.
So do you offer any regenerative therapies in your practice?
We do have PRP. It's not something that I've been actively promoting, frankly, just with like being one person and there's only so much, so many hours in the day. So we do have a PRP machine. We do some of them from time to time. I've taken some of the tenotomy training, but I haven't, done it with patient yet. So, so I'm interested, and I know enough to ask some good questions. And I think it sounds like a really neat therapy. You just have to have the right, I think it's a lot of things. It's like having the referral stream and the right patients and all that, makes a lot of sense if you can, create a pathway in the practice for that.
Mm-hmm. Absolutely.
Yeah. Very good. Well, good. Tell me more about, do you have any success stories? Do you have, any special success stories that you'd like to share with our group about where, Concierge Sport and Spine has made a difference?
Sure. I feel like, we're just getting started. I just opened my practice July 5th of 2022. I was employed prior to that at a large orthopedic group. So as far as patient stories, so some of my old patients are finding me, and some, of course, we're getting some new patients. So the one that comes to mind the most is just sitting and actually having the time to like listen to patients and kind of really understanding where their pain is coming from. Yeah. I had a patient that had 3 epidurals from another physician. I guess they didn't quite grasp where exactly the pain was coming from. I did a really good exam and I said, why are they treating this level? Your problem is at the level above. And so I said, if you're open to it, let's give it another try. And the patient was kind of hesitant because they were sick of getting poked. Let's do your injection at this level where your stenosis is actually really bad. And hopefully I can give you, some relief and you can push off surgery. And that's exactly what happened. We did the level above and I did a bilateral transforaminal, and he was so thankful that within a few days he felt amazing. And, he was ready to go to the OR, and, we don't know how long it's going to last, but the fact that I was able to actually help him and gave him the relief, I think he was just so thankful. So I really like treating patients like that that actually like they want to get better. They appreciate it. And then, and I tell them, you got to move. You can't just expect I'll do my part, but you've got to go to therapy. You've got to build your core. You've got to be flexible. So I think it gave him that oomph that I think he needed to get back into shape. So
that's awesome.
That happened last week. So that's that's
what's on our brain. Yeah. No, it's a real difference maker for sure. Like when you can connect with people, and I think that's just a huge deal in medicine, to be able to have that time to connect with patients. And I think you're right. I mean, that's some of the challenge with pain is it's not always obvious exactly where it's coming from. Sometimes Sometimes it is, but sometimes it isn't. And to have some time to work through things and weigh different diagnoses, different treatments, et cetera, I think is definitely a big deal to be able to connect.
Yeah, absolutely.
And so I'd be interested to hear about like your top tips to stay healthy. Are there any special diets or exercises or, I would say for myself, I definitely make a lot of referrals to physical therapy and encourage people to move as much as possible, but it's challenging too, right? Because like, well, what is the most that's possible and how do you help people figure that out? So how do you talk to patients about, finding those ways to stay healthy?
Yeah, it is a challenge. We can say the words over and over again. Whether it sticks is always a challenge. So, my top thing after they go through physical therapy and they're all better is I tell them get into yoga. Go online, go on YouTube, whatever you need. Find some type of yoga that will sustain your relief, because yoga will get you, it kind of is a combination of the stretching, core exercises, and the meditation. So you kind of get like three things in one with yoga.
Yes.
And that's what I'm trying to do in my practice eventually, is have like a mini yoga studio and then have a 1-to-1 or maybe like a 1-to-4 like situation where after they're done with therapy, they're done with me, they're done with my injections. And then this is a way I can say, okay, this is how you're going to maintain it and teach them.
Yeah.
So, because I can say, go on YouTube, do yoga, but do they really do it? I'm not sure.
It's hard. Yeah. I think we all feel busy. We all feel like we have obligations with our jobs or families or both. And, how do you make time for one more thing?
Yeah. So that's my number one recommendation after they've finished physical therapy, is get into some type of yoga. Number 2 recommendation is obviously optimize your diet. I give them the challenge of a 2-fruit challenge. You'd be surprised how many people don't even eat 2 fruits a day. So I said,
I like it.
Yeah, here's your challenge, 2 fruits a day. And the other challenge is take out sugar from your coffee, tea, soda, whatever. Those are the 2 things I want you to do first. And they're not hard to do. But again, you'd be surprised at how frustrating it is to like get through to people and say, okay, 2 fruit challenge, take out sugar.
Yeah.
They're so stuck in their habits. So
yeah. And you have to kind of meet people where they are, right? If they have to be ready. And I think, right, like change your diet is a little too broad, right? So that's what I like about this. Sounds good. The 2-fruit challenge, and then asking questions about sugar intake and beverages, right? That's an easy way to limit some of folks' daily sugar.
Right. And then there's one trick I use, because I used to love soda, is sparkling water and adding just a little bit of juice to it. So you get that not the caffeination, you get the the soda feeling.
Yeah.
And but you're not drinking a lot of sugar. So I've started, and then I just kind of cut that part out and just drink sparkling water. So it still feels like I get that carbonation is the word I was trying to say. Carbonation feel, where you can gulp down carbonation and it's not sugary.
Yeah.
And then my last recommendation is hydration. Again, very obvious. We all know we should do it. I've got my water bottle here, and I should have filled this 3 times, and I've barely even finished one. Is that if you're dehydrated, your pain's going to be worse. Your body's not going to be able to move as well. And I try to emphasize the hydration. So when you're in a lot of pain, you gotta stretch, you gotta move, you gotta have good nutrition, and you've got to have good hydration. And with the combination of all that, usually I try to talk with people and get that through to them. And again, I don't think doctors have enough time to really get through to the patients about these lifestyle changes.
Yeah.
So that's what I'm trying to change in this like concierge practice is that I'm going to have different like situations or stations of like maybe like have other people helping me to get through to the patients about what they need to be doing to stay healthy.
Yes.
Because it gets a little frustrating if you know I'm there. It's just like they see the patient, do an injection, they don't get better. I mean, they get better and then they keep coming back. Do the injection, see the patient, they get better, but it keeps coming back. So my goal is to like,
yeah, if you can break that cycle.
exactly.
Yeah. Yeah. And often, you know, the patients may be frustrated with their situation too, right? I mean, I think, to me, if there's probably not a whole lot of positive of that, except that if we can harness it to like get people excited to make a change, right? That like,
Yeah.
hey, this is not working for me. Let me see about making a change in my diet or in my activity level. I think that's, you know, that is a way where you can be, you know, engaged in that care with people, but then also helping them move to the next level, reminding them, hey, you know, we're gonna be doing this again if we don't do something else different.
Right.
Yeah, so true. Well, thank you so much. You know, I think I've covered what I wanted to cover with you. I would love to do this again. I think that this is a great intersection because I'm super interested to talk about, you know, just the healthcare environment for, you know, for our patients, for pain docs. I'm glad to speak about, you know, how you guys are trying to do it different, and I'm excited to see how you can implement, you know, some of these, you know, frankly, they're like best practices, right? To try to have, you know, multidisciplinary care, right? And what does that mean for our viewers? You know, that we're not just only prescribing a medicine, not just only doing an injection, but that the multidisciplinary care may involve, you know, multiple types of interventions, including maybe dietary, medication, et cetera, et cetera. I have put your webpage in the comments here. So I would be glad to share that. So if you want to tell us more about where to find you, Dr. Khanna.
Sure. So I'm in Philadelphia, like I said, 1200 Constitution Avenue. Very easy to remember if you are in the Philadelphia area. You can also find me on Instagram, Dr. Malini Khanna. I have a YouTube page as well, Malini Khanna MD, opposite. And the website is www.cssmpa.com. So that's Concierge Spine and Sports Medicine Pennsylvania.com. And
Awesome.
yeah, so we got social media links on the website. So everything's up on the website. You can find me there.
Thank you so much for being here, and we hope to have you again.
Thank you. This was fun, and I hope to be back.
Take care.
Thanks. Bye-bye.